The first problem is in fact that we cannot do biopsy in all cases because sometimes you have brain mets as an example. It's not so easy to biopsy. The second time is the patient should not be amenable to for a biopsy because of his or comorbidities, as an example, like an anticoagulation that cannot be stopped. And third, we know that we cannot have a molecular analysis on all the samples that we are biopsying. We know that the quality of the tissue is not the same when you are biopsying lymph nodes or lung tumors, or the main problem is represented by the bones, and we know that it's very difficult to do molecular analysis on some specific samples. And I think that it's not so rare, because when we look at prospective data that we have, and we have to keep in mind that these prospective data are collected in very highly specified centers, we can see that for some type of sampling, it's sometimes up to 50% or 60% of the samples that are not amenable to molecular analysis. And we can imagine that in the future it will be probably more when these kind of techniques will be widely used. For sure, when it's difficult or it's not the best way to access to the molecular analysis in doing tissue biopsy, looking at liquid biopsy will be very important. Whatever the type of liquids, which could be the blood, which could be urine, which could be CSF, then I think that this kind of samples in order to do the molecular analysis will take a huge place in the future. Probably it has many interests. The first one will be probably to do the molecular analysis in order to give the patients an access to one specific targeted drugs. But probably in the future we'll be also able to monitor the disease and maybe isolate as early as possible the mechanism of progression in order to provide the patients with a new strategy before the disease becomes clinically or radiologically progressive. Accessing to tissue in the simplest way as possible is for sure the goal of all the procedures we are doing. Then we know that supraclavicular lymph nodes are very easily clinically available. We are doing for a long time surgical biopsy of these lymph nodes in order to do molecular analysis in some cases. And for sure, doing less invasive techniques like fine needle biopsy aspiration will be interesting, and we know that this kind of techniques is reliable for mediastinal lymph nodes in order to do the molecular analysis.